Hello, everybody. Welcome to another insightful episode of Aesthetify India podcast. Today, we are here to discuss a very important and critical topic in aesthetics: non surgical versus surgical facial rejuvenation, and very importantly, where do we draw a line? We have with us a guest speaker, a very renowned plastic
Thank you.
surgeon and aesthetic surgeon from New Delhi. And Dr. Sukhbir will guide us in assessing the different possibilities and limitations of non surgical aesthetic
Yes,
treatments.
absolutely.
And also, he will tell us that where it is the right time to go for a surgery.
Yep.
So, a very warm welcome from Aesthetify India, Dr. Sukhbir.
Thank you, Gunjan. Thank you for the kind introduction. Yeah.
So, sir, we've met so many doctors, so many consumers, and we have observed that the biggest question in today's customers and practicing doctors is um, there are so many options available when you know that there is something needed for facial rejuvenation. There are dermal fillers, there are thread lifts, then there are energy devices, and when it is the right time to really go under the knife.
Yeah.
So we have to draw in today's podcast the line, a system where we actually can assess the whole situation.
Yeah. So, Gunjan, whenever the patient comes to you, we assess the patient as a whole. Now, patient comes in different age groups. Like the common age groups which come to us are usually between 25 to 35 years and 45 to 55 years. So these are the two most common age groups which come to us. Now, if somebody is coming from 25 to 35, obviously they will never want to go under the knife. They'll seek some treatment which are like office-based treatment. They are like they just get it done and they just leave. So for them, ideally, if they're just starting to do the anti-aging processes, so we have a lot of good devices. We have energy-based devices, we have toxins, we have fillers, we have threads. So obviously, depending upon each and individual phase, like suppose I'll give you a scenario. We have a young female, a 28-year-old female, who comes to us. She walks in. Now she comes to me and tells me, Doctor Saab, that I was about 100 kilos. I've lost a lot of weight. Lost about 25, 30 kilos, and see how my skin is looking. It's looking very aged. So obviously, the skin has sagged down. Because of, when she has lost weight, she has lost a lot of collagen. She has lost a lot of support. So we need to support her. So in that case, we need a combination of thread lift. We need energy-based devices. We need some skin boosters, and maybe some dermal fillers touch-ups might be required. Now, what is required first and what is required second and third subsequently depends upon assessment, because we are all clinicians. Okay, so we all assess. So if I have to do a combination of energy-based device, a toxin, and a filler, first of all I'll do energy-based device. Because heat energy comes first. So I like to do energy-based device, wait for some time, and then add on my thread lift and toxins and maybe some fillers, depending on what is the requirement. If similarly, elderly patient or middle-aged or elderly patient comes to me like 45 to 55 years, now that's the place where a line has to be drawn. Suppose a 45-year-old lady comes to me and says, Doctor, I've got a lot of under-eye bags. Please correct it non-surgically. Now, if it is just a beginning of eye bag, yes, it can be taken care of by dermal fillers. But yes, if she has a full-blown eye bag which is really visible, then the option is only surgery. We have lower blepharoplasty surgery to do. That case, we cannot offer her a dermal filler. If she still insists, we can just tell her that a dermal filler may help to camouflage. May is important because we know that it might help in only 10 to 20% improvement, or maybe lesser. So if the patient is okay, we go ahead. Otherwise, surgery is the first option in that particular case.
Wonderful introduction to the opening of this podcast. Now we will break it down for our audience over here.
Absolutely.
So we have seen that non-surgical treatments have come very far. There are very sophisticated treatments which are available in the market. So I would like to understand your perspective how these are vis-a-vis traditional surgeries. We can break it down for traditional surgeries later,
Yeah.
but what do you think that these have become better over the years with better technologies, and how it is more convenient for the patients to start their aesthetics journey?
Non-surgical treatment, if I tell you, so I started my non-surgical career in 2009, when I did my first filler and toxin. So that time it was very naive, and hardly people knew about it. In fact, even till last 5 years, if I talk about, people still get confused between toxin and filler. They don't know, and they'll just come say, "Doctor, I want toxin for this area, or toxin for this area. Please improve my smile line with only toxin." So we have to explain them what exactly is toxin, what exactly is dermal filler, and what can be achieved by each of them. Now, if I talk about the trend from 2016 onward, we have seen that in India, the aesthetic market has gradually improved. So from 2009 to 15, it was very slow. People used to come on and off. We used to tell them, inform them, and maybe there was some percentage who get used to get converted. But now, thanks to COVID, and when people saw themselves in Zoom meetings and saw themselves much more in the mirror, the aesthetic treatments actually have gone uphill now. If I talk about the last 5 years, when 2025, from 2020 to 25, if I talk about, I think the aesthetic market has become leap and bounds. So patients nowadays, they automatically tell us, "Doctor, I need toxin for my forehead, I need fillers for this." Obviously we are clinicians, so we are here to guide them, see what is the optimal treatment for your age, for your area, and for your region, and how we can combine the multimodality, because if you see the market and if you see the options, we've got several options. We have got energy based devices, toxin fillers. Now we have skin boosters, which are like hydration molecules, so what should a patient choose? So as clinicians, we have to guide them. How do you can choose? That's why we make a 1 year treatment plan, that today you get this one treatment done, come back after a couple of weeks, and then we start another treatment. It's not necessary that every treatment has to be done everything on day one, so that's important.
Very rightly said, sir. So, I will be very specific to treatments
Yeah,
now.
absolutely.
So, dermal fillers,
Hmm.
you think is a good starting point for skin rejuvenation? It is getting very popular. We all know that, as part of the industry.
Hmm.
But do you think it is, the right way
Hmm.
to, not right way exactly, but it is a good way, a more feasible way to start your aesthetics journey?
Absolutely. So, if I talk about dermal fillers and toxin, if you permit me,
Yeah, yeah,
so I think toxin or dermal filler combination works fantastic if it is done the right way, and if the patient can start early, like as early as 30 to 32 years, if the patient can start, like toxin, if I talk about, if the patient starts early, chances of getting static lines here, which a lot of people will come to you and say that, "Doctor, these I can see these 11 here, please erase them." So if a patient of 55-year-old and says, "Doctor, I have these lines now, erase them," not possible, because they've already converted from dynamic to static.
yeah.
So toxin will definitely help some component of static, but obviously it cannot erase that. Okay. So if you start early, yes, you have a long-term result, and obviously if you sustain it, you get the regular settings done, and you can have maintain a long-term result. But if a patient walks in late, obviously we can still help them, because our age group most common which wants dermal fillers nowadays about 35 to 45, and maybe sometime late 45, so obviously dermal filler is the starting. And the advantage of dermal filler is that it not only lifts your skin if done properly, it can actually even hydrate, because the main component is what is hyaluronic acid. Okay, so obviously depending upon what area we are doing, we can choose a filler. We can choose a filler which will help in lifting. If I have to just lift the areas, I'll use something which is a heavy filler. If I just need some volumization, she has lost some volume here, maybe some smile fold, I'll use a different filler, a softer filler to rejuvenate. Or somebody wants a lip filler, she wants, she has very small lips, she has a function coming up, she wants to hydrate them, plump them. I think dermal fillers are absolutely a gorgeous option for that, because it gives an instant result. It's like that, you just get it done within 15 minutes. Patient can see actually, yes, some changes are coming.
Yeah.
Obviously the full effect takes about 2 weeks, but at least the patient can see some 60-70% result right on table. I think no other treatment does that. So I think fantastic.
With such minimal downtime.
Absolutely. And like, if the patient has a function, I mean, 2 days she's ready. I mean, she can go ahead, just a side makeup, and she's all set to go.
You raised a very important point regarding lifting. So, with dermal fillers, we all know that lifting happens. But when is the right time to go for a facelift surgery?
Okay, so now facelift and dermal fillers, like they are like two far apart things. Okay, so facelift, we, as I told initially also, that typically we do facelift only after a certain age. So if somebody is walking at the age of 35 years, obviously I'll never do facelift. I'll offer them a thread lift and maybe a dermal filler. Even till the age of about 45, 46, I'll like to do some non-surgical options for that. Yes, if a patient of 50, 55 is coming to me and saying, doc, see the amount of sagging, the neck sagging and all, obviously facelift becomes the first option for that area. But yes, what we do in facelift is, what we don't use dermal fillers that time. So what we do is, during the facelift surgery itself, we just take out some fat from your body. We just condense that fat and put it in the areas where there's a volume loss. So it's called facelift with fat grafting or microfat grafting, if I need to put it that particular way. So we can rejuvenate that because fat itself is a beautiful molecule which is full of stem cells. Not only volumizes but also changes the skin texture. It has got a lot of stem cells. It rejuvenates the entire face. So that time obviously the filler is not required, because anyway we are doing a surgery, we are lifting the entire structures as one, and then we add fat wherever it is required.
Okay. Now talking about under eye bags,
Absolutely.
because this is a very big concern area
I think
and
most common.
most common and the most complicated to treat with.
Absolutely, absolutely.
We know that dermal fillers can be helpful,
Yes.
but I want to understand where to, really say no, that this is not the right time to do the dermal fillers. We have crossed that stage, and here you have to go for a surgical
Okay.
option.
So I'll break into two parts this question. So I get a lot of clients of different age groups. So if I talk about 10 to 15% of the clients I get from my fellow dermatologists. Why? One of the main reason is the lower eye bags. They tell me that, Dr. Saab, she is my old client. I've been doing dermal fillers for a long time. Now the situation has come that the under eye bags are not going at all. Whatever I do, I'm not even able to even camouflage that. So patient is in distress. She wants some help. What should I do? Then the option is only lower blepharoplasty and the upper blepharoplasty. And especially the lower blepharoplasty. If I talk about the under eye bag, as you have rightly said. So that is the time then we need to do only a blepharoplasty surgery and reposition the fat pads. That time dermal filler cannot help. So only initial, if there is a fat pad which has prolapsed, yes, dermal fillers can help to camouflage, and if done in a proper way, they can help to stretch the ligaments and just decrease the eye bags visibility. But if you talk about erasing the eye bags by dermal filler, it is not possible. Let's be very, very clear on that. Okay. So if somebody has come to you and says, Doctor, I don't want any eye bags, please erase them. Please 100% camouflage them by dermal filler. It is not possible. Because once the eye, let's understand why eye bags form. Eye bags form because the ligament gets loosened up. So the fat collapses down. Obviously, I cannot explain you more surgically, but once it does, dermal fillers can, yes, help only up to initial stages, but after some time, blepharoplasty is the only option the patient has. And after that, obviously, patient can get dermal fillers for other areas, not necessary.
Okay, great. I think I've understood a lot about it. Now, talking about another popular indication, especially in Indian market, which is picking very well, jawline contouring.
Yes.
Again, we have to segregate the patients.
Absolutely.
Who is more suitable for filler, who is more suitable for another surgical treatment.
So now there are two scenarios here. Most of the Indian patients who come to us, even nowadays, we have a lot of Indian males who are coming to us for jawline contouring. In fact, more than females, now males are coming for jawline contouring. Gone are the days that only females wanted to, do a jawline contouring. But I think from COVID, if I talk about, a lot of males are coming for jawline contouring. They want a perfect jawline, they want a perfect shape, want good contour, and whatnot. So the problem is that most of our Indian patients, they are expanded laterally. Okay, that means this part is very, very heavy for them. So again, if I talk about two age groups, 35 to 45 and 45 to 55, so somebody is coming from 35 to 45 typically, I'll offer them a thread lift first. I need to lift all the structures. I'll do a thread lift all my structures so that I can give support to this area, and then add fillers to give a good contour to the jawline. If I just do the fillers that time, I'll not be able to give a good contour because my structures are still hanging. So I need to support it, give a good support in the temple area with my thread lift, and then add dermal fillers. Now somebody comes to me again late 45, 48, 50 years and maybe above that, then obviously a patient is willing, I think I'll go for surgery first. That is my first option. And in surgery, I can always combine my RF and my other things which can be combined along. So that time I can do a mini surgical facelift. I can do a neck lift or maybe a combination of that depending upon again the assessment, because ultimately we are all clinicians. We have to assess the patient. It's not necessary that every 50-year-old male or female will require a surgical facelift. Let's be very, very clear on that. Not everyone requires. Again, depends on my assessment. If I still feel that by that patient has really maintained herself or himself, I still might go for non-surgical because obviously the downtime is very quick in non-surgical. So I have to ask the patient, what is your profession? How fast you want to go to work? Can you miss your work for 2 weeks? Because your face will be swelled up after surgery. Are you ready to do that? If you're ready, you will have a cut here, you will have a scar around your ear. Are you ready for that? Most of the Indian patients, if I talk about, so if I see about 10 patients for surgical facelift, about 6 or 7 will say, Doctor, let's try non-surgically first. Whatever maximum we can fix. If you if I still feel after a year or so I'm not able to appreciate it, or I'm not very happy with it, then I might think of surgery. So non-surgical is actually one of the ways to engage your patient. And if patient is happy, trust me, conversion to surgical is actually 100% there.
Absolutely.
So if a patient is happy with low blepharoplasty, a conversion to surgical facelift is actually almost 90% plus.
Okay.
So that's the way.
That's the trick to be noted.
Yeah. Because so if the patient is satisfied with your treatment, if the patient is convinced that you have assessed the patient properly and you have actually shown them, yes, this treatment really helps. Why will the patient go anywhere?
Then trust is
Then the trust is built up already.
built up. Yes,
Trust factor, when the trust factor build up, it's already it's already on the way.
absolutely. Another important point raised by user, combination.
Yes.
So I want to flip the tables now. I want to understand that along with surgery, what non-invasive treatments you club, if at all.
Okay, so obviously on the day of surgery, I don't want to club up a lot of things. So first we'll do the facelift surgery. We'll do the microfat grafting. We'll do the neck lift, neck liposuction, or neck tightening using RF, whatever is required. Obviously, it's a generalized question, so I cannot answer on the point. But yes, depending on my examination, what all is required, I'll do that. Now, after surgery, I'll let the wounds heal completely. After the suture are removed, everything, the patient has healed and all everything, I'll call the patient back in about 4 to 6 weeks time.
Okay.
That time the edema would have settled. So once the edema settles and patient wants, okay, doc, I have some dynamic lines on my forehead, I've got some crow's feet, corrugated, so I might do some toxins that time. And if the patient wants, doc, I want some more better glow, I might add some skin boosters that time. And so it's always a combination. Or sometimes what happens is a lot of patients have acne scars, or patients have some irregular skin texture, so that time we can add on micro needling, we can add on some peels, we can add on some serums, infusions we can do, but depending upon what is the requirement. So I think skin quality is one thing which we are really working on nowadays, and that's why I think the skin boosters have a big role to play now. Because earlier we were just talking about everything inside the skin, how to look good, how to have a chiseled jawline, how to lift our skin, everything. But nobody was talking about skin glow. Nobody was talking about skin quality. I think skin boosters have come a big way now, and in fact, in our practice now, we are using skin boosters a lot. So I think it's a way forward. So I think skin boosters has a lot to come in more demand.
Now, very controversial topic, very common topic, overfilling. And I
Okay.
always ask my speakers what is their take on that, because it is very important to understand from the horse's mouth, right? That is it
Okay.
a hype? Is it the wrong technique? Is it the wrong product? What is it exactly contribution? The overfilling is contribution of.
Okay. So there's something called the terminology which after COVID came was called the overfill syndrome. Okay. Now I will not talk about whether it is wrong technique or overfilled or something. I think thanks to Bollywood, we have seen a lot of overfilled. In fact, in my clinic myself, I've dissolved a lot of overfilled. Now, people have different opinions. They'll say that, doc, I told them to just put some and they put more. That is one option, one thing. Or sometimes they say, no, I thought, it's a trending, I want bigger lips,
Mhm.
bigger lips like celebrities,
Mhm.
and just fill it. But now I feel it's a bit more. So, I think I'll dissolve some of it. So it is actually the perception of the individual client. So we always tell the patient, counsel the patient that you can always add on later on. So day one you should never get overfilled. Try to avoid that, because see, once I'm doing a high lasing, I'm dissolving it, I can dissolve it. It takes about seconds to dissolve it.
Right.
But it's your money, you have lost your money. It's You have spent money in your filler. To dissolve it, it just takes 10 minutes.
Right.
And obviously you're paying for that also, unfortunately.
Right.
Because you're getting filled somewhere, you're dissolving it somewhere, so
Some.
you're paying for it also. So why you want to get overfilled? Okay, just for because that particular celebrity, he or she has overfilled themselves, you want to try to mimic them. See, they might have done it maybe for some role, because a lot of celebs do it. They either lose a lot of weight or they gain weight, but it doesn't mean that you have to follow that. It's your own body, you have to understand that. So if you feel that getting overfilled is like, a fad, okay, get it done. It's up upon you, But as a clinician, I just advise that try to avoid overfilling. It looks very unnatural. So idea of dermal fillers when it came to the market, or even today, the idea is that we do dermal fill in such a way that you should look natural. That means you should look a better version of yourself. You should not look overfilled. You should not look like, oh, you have become a monkey, or your lips have become, like a duck. So that's very unnatural and that's very unwarranted. So that's my advice, that think about it whenever you want to go for it. First of all, search your doctor. I think that's very, very important, because a lot of quackery is going on. I think that's a big topic to discuss if I start talking about it. But unfortunately, there are a lot of things which are very uncontrolled in our Indian scenario. So a lot of quackery is there. A lot of untrained doctors are injecting, which is actually leading to overfill. That is the problem. So because they do not have a control, for them they have, like, they have bought some syringes, they want to finish it, and they have a client, so they just infuse it. So they don't have a control. And when the patient finally sees that, oh, what has happened to me, then they run, oh, I should seek a doctor. Then they go and actually find a qualified doctor. But why can't you do a research before and go to a qualified doctor from first hand? I think that's a better option. Why you want to spend your precious money unless you have got too much money to spend?
Right. Okay. Now, dermal fillers, how they have evolved over the years,
Hmm.
because they have been in the market and there are
Absolutely.
newer products, newer options available. So,
Absolutely.
do you think that new age fillers have something better to offer?
Yeah. So if I talk about from 2009 to now, I think fillers have changed a lot. It's like, I think the cohesivity of the filler, the quality of fillers, the ease of injection of the fillers, I think everything has changed. No, I mean, the new generation fillers are perfect. I mean, they're so smooth. Like, I mean, using EPT killers also. I think so smooth to inject, ease to inject, makes life quite easy. And obviously they're giving more natural results.
That is very
I think
important.
one reason to give a natural result is that we are trying to avoid to over inject. I think that's very, very important. I think the take home message should be never to over inject. I think that's a key takeaway for young injectors. That over injection is very easy to do, but ultimately it is spoiling your reputation. Understand that. But if the patient is not happy, trust me, the trust is gone and patient never come back to you. And losing a client means you're losing three more clients. So choice is yours, my friend.
I think you've summed it a lot. But again, would you like to have a last word for your young patients out there? Any
Yeah,
advice,
yeah.
key takeaway you've already handed over?
So younger patients, first of all, start treatment a bit early. Don't wait yourself for 45 to 50 years, and then, oh, I'll see the wrinkle completely when it start take, then I'll only start. No, start a bit early. Secondly, even if you don't want to go for fillers initially, Go for skin boosters. At least hydrate your skin. And yes, take care of your skin. 90% of the people who walk into the clinic, if I ask them, do you use a sunscreen? I yeah, doctor, sometimes I use it. There's nothing called sometimes. Sunscreen has to be part of your regimen if you are actually seeking aesthetic treatments. Anti-aging, trust me, sunscreen is the cheapest and the best option you have, and the first thing you should actually start from as early as 20 years of age. Anti-aging you can still start by 30, but sunscreen has to be even before, maybe 20 or even before if you can start, as early as even nowadays young girls I see, young boys, they're going for swimming, they put sunscreen. If you go to Western world, youngsters, 8, 10, 6, any age group, they are applying sunscreen and then, but that's still to come into practice on an Indian scenario. But if you're seeking anti-aging treatment, I think take care of your skin, very, very important, and start treatment early. And I think dermal fillers are here to be there, and especially skin boosters. I think they are the game changer longer. Thank you so much.
Thank you so much, Dr.
Thank you.
Sukhbir. I think this has been a wonderful session for all of us, for the doctors, for the patients, and it has been a very good learning curve for me as well. Thank you for sparing time for
Thank you.
us, sir. And if you are liking this content, please do not forget to like and subscribe Aestherify India so that you can stay updated with our rest of the episodes. Thank
Thank
you
you
so
so much,
much.
Gunjan and the team at Citra India. Thank you so much.